Surgical or non-surgical rhinoplasty. If you are someone who wants to get a rhinoplasty but couldn't afford it yet, so you're considering other options, or you just want to know what each procedure is, then let me walk you through all the things that you need to know by the end of the video. But before that, I am Anne, and 2 months prior to filming this video, I had my rhinoplasty done. And of course, before going through the procedure, I have spent roughly about 7 months doing my research and going through forums and contemplating. And of course, part of the decision process is whether to get a surgical or non-surgical rhinoplasty to achieve the nose that I want. So let's go over through each of the procedure, discuss the pros and cons, and for whom I think each procedure is best suited for. Rhinoplasty is any procedure in your nose that is intended to change its size and shape and sometimes its function. So before, when you talk about rhinoplasty, it straight up means like going under the knife or the surgical ones. But as cosmetic science evolved, there are already non-surgical options. The most popular ones are nose fillers and nose threads. Nose thread lift, or sometimes called Hiko thread lift, when translated literally from Korean, it means high nose. It makes use of absorbable threads made of polydioxanone that is biocompatible with the human body. It has been used in medical applications for many years because it is proven to be safe for the human body. So the procedure is done by inserting a tube-type injection needle containing your thread that is shorter than your needle, and then the doctor would push in the thread using a plunger and pull out only the needle. It is a very quick process. So what are the pros? It is cheaper than the surgical rhinoplasty, and number 2, it has a very minimal downtime, and 3, it is a very quick process. What about the cons? Of course, it is temporary because it is absorbable by your body. But a study on 62 patients have found out that the nose threads are still able to maintain the height of the bridge and the projection of the tip after 10 months. So you can estimate that it would stay with you about a year or so. Number 2, the maximum projection of your tip and the height of your bridge couldn't be as high as a surgical procedure. And number 3 is the risk of extrusion. Now take note that in the same study, out of 62 patients, 1 experienced an extrusion. So always remember this because you can never rule out the possibility that you will be one of the 1.6% of the statistics. So there will always be risks. Now number 4, take note because this is very important. If you are planning to have a rhinoplasty in the future anyway, take note that your future procedure will be much more complicated. Because when the thread is inserted, there will be structural changes in your nose. And by the time that you're going to have your surgical rhinoplasty, there will be additional charges because it will be treated as a revision rhinoplasty. So the additional charges would be around 10,000 to 20,000 pesos, which is about the same price as your nose thread lift. So do consider this when making a decision because I would suggest that if you are very sure that you're going to have a surgical rhinoplasty, just be patient and wait until you have enough money for the surgical rhinoplasty. Nose filler, or sometimes called as the liquid nose lift, it involves injection of hyaluronic acid to add more volume to your nose. Now what are the pros? It is cheaper than the surgical rhinoplasty. Number 2, it has very minimal downtime, and 3, it is a very quick process. Now what are the cons? It is temporary because it is absorbable by your body, and number 2, it couldn't create as drastic changes as the surgical rhinoplasty, and the same, number 3, yours will be treated as a revision case if you are planning to have a surgical rhinoplasty in the future. And number 4, though there is no risk of extrusion, note that there is a serious but very rare risks of blindness and skin necrosis if the filler is injected in your blood vessel. So make sure that your procedure will be done by a professional and qualified practitioner. Now, who should have nose fillers? If you have a small nose and you want to achieve more height and volume, then you may consider a nose filler. Who should have nose thread lift? If you have wider or bigger nose and you want to achieve some sort of contouring and teeth projection, then nose thread lift may be the best option for you. Another important thing to remember is that nose thread lift and nose fillers are additive procedure, meaning you can only add volume and never reduce. Though sometimes, like adding a height to your nose can give an illusion of a narrower nose. However, technically, you are still adding volume. And if you need a reduction procedure, then the surgical procedure is the only option for you. What about the combination of nose thread lift and nose filler for the best result? Well, that is possible, but you have to talk with your doctor, and we will not cover that in this video. Now let's head on to surgical rhinoplasty. Surgical rhinoplasty is any procedure in your nose that changes its shape and appearance and involves incisions. But if you are afraid of blood and surgery, you don't have to worry because you can choose to be sedated like me. So I just fell asleep and then woke up pretty. The most common implants in surgical rhinoplasty are silicone, Gore-Tex, or the patient's own cartilage. Could be the ear cartilage or the rib cartilage. Now let's go over the pros and cons of surgical rhinoplasty. One major advantage of surgical rhinoplasty is that it is a highly individualized procedure, meaning there is a very high probability that you will achieve the nose that you want because of the number of specific procedures that can be done to make the changes that you want. But of course, that all depends on your doctor's skills. And number two, it is likely to be permanent. Depending on your case, of course, there is a risk of infection, but we will talk about that later. And number three, you can really achieve drastic changes in your appearance, but all depends on your doctor's skills. What are the cons? Of course, like any other surgeries, there's always the risk of infection. Now, these are the studies that have been made on surgical rhinoplasty and the corresponding data on infections and rejections. Now, you can pause the video if you have to, but we don't want to take so long, so let's continue. And number two, of course, it is much more expensive than the non-surgical procedure. Number three is that it has a long downtime or recovery time, so you will be ugly for a short period of time. The worst time would be the first week while you have your cast on, but it will get better with time. Number four, revision takes time and much more money. And lastly, there is a risk of scarring, but that depends on the skill of your doctor and your post-surgical care. Gore-Tex is a popular option for implant. In fact, it is the kind that is used for my nose along with my ear cartilage. It is a fibrillate polymer of, wait for it, polytetrafluoroethylene with micropores where, when implanted in your nose, your tissues will grow into the pores, creating a stable implant. The disadvantage of Gore-Tex is that it can shrink over time, but not very significant because your tissues would grow into them. But for some, they like this effect because it creates a more natural look. Another disadvantage of Gore-Tex is that in case of revision procedure, it could be very complicated because your tissues are integrated into the implant, so it is very much harder to remove than silicone. Silicone has been around much longer than Gore-Tex, and many doctors still prefer to use this implant, and silicone can be very precise to the shape that the patient wants. Unlike Gore-Tex, which is likely to shrink slightly, silicone is better in retaining its shape and size. And lastly, it is much easier to remove in case of a revision. What are the cons? Well, number one, migration is a risk in silicone implant because unlike Gore-Tex, it lacks integration within the nose structure. Lastly, it can feel hard and unnatural beneath the skin, but at least according to the people I know. But maybe it could depend on the kind of implant. Maybe there could be a softer variation of silicone, so that depends. So that's it, and as a parting word, remember that your nose is the central feature of your face and it can very much improve your appearance if the procedure is done well. So make sure that you choose the right doctor for you. Also, whichever procedure you decide to have, remember that there are always risks. So don't rush, take your time, and do your. If you have questions, let me know in the comment section down below, and I will also link a video of my nose job experience, so check that out. And that's it, and see you in the next video. Please like,